Hello, I'm your 3-star student. Today, let's learn how to pass OSCE exam. Ready? Let's begin.
Welcome to your comprehensive guide to mastering the OSCE, or Objective Structured Clinical Examination. This masterclass is powered by 3-star and is designed to transform you from a nervous student into a truly confident nurse. We'll meticulously break down the OSCE success blueprint, focusing on 3 core pillars: consistent practice, unwavering professionalism, and, above all, paramount patient safety. Every aspect of this blueprint is here to empower you, providing a systematic approach to excel in your clinical assessments. Central to our philosophy, and crucial for your success, is this powerful mantra: I don't need to be perfect. I need to be safe, systematic, and professional. This isn't about flawless execution every single time, but about consistently demonstrating a methodical, safe, and professional approach to patient care. Perfection is an ideal, but safety and systematic practice are non-negotiable foundations of nursing. Your examiners are looking for these fundamental competencies. Remember, mistakes can happen, but ensuring patient safety through systematic care and professional conduct is what truly matters. Understanding what examiners prioritize is your first step to success. They are evaluating a holistic picture of your nursing capabilities. First and foremost is patient safety, ensuring no harm comes to the patient. Then, communication skills, your ability to interact clearly and empathetically. Professional appearance reflects your respect for the role and the patient. Clinical competence demonstrates your foundational knowledge and skill application. Infection prevention is critical for patient well-being and is often a zero-tolerance area. Confidence, shown through your demeanor and actions, reassures both the patient and the examiner. Critical thinking highlights your ability to analyze situations and make sound clinical judgments. Documentation is essential for continuity of care and legal accountability. Finally, time management demonstrates efficiency and organization under pressure. Remember this crucial insight: examiners award marks for what they see, not what you know. It's not enough to possess the knowledge, you must actively demonstrate it through your actions and communication. Infection prevention is paramount in any clinical setting, and your OSCE will rigorously assess your adherence to best practices. Let's walk through the critical steps. First, hand hygiene upon entering the patient space. This is foundational. Second, introduce yourself clearly and professionally. Third, confirm patient identity using at least 2 identifiers to prevent errors. Fourth, explain the procedure you're about to perform, ensuring the patient understands. Fifth, obtain consent for the procedure after your explanation. Sixth, wear PPE if indicated for the specific task and patient situation. Seventh, maintain aseptic technique throughout the procedure to prevent contamination. Eighth, dispose of waste correctly in appropriate receptacles. And finally, hand hygiene again before leaving the patient's area. This completes your infection control cycle. As the golden rule emphasizes, missing hand hygiene can cost many marks. It's often the easiest and most frequently missed step, leading to significant point deductions. Make it a reflex, not an afterthought. Effective communication is the cornerstone of patient-centered care and crucial for building rapport and trust, especially in an OSCE scenario. Let's look at some key phrases. For introduction, always begin with, "Good morning. My name is a student nurse." This sets a professional tone and clearly identifies you. For consent, ask, "Is it okay if I proceed?" This respects patient autonomy and ensures their agreement. Throughout the procedure, offer reassurance with phrases like, "Please let me know if you experience discomfort." This demonstrates empathy and attentiveness. At closure, express gratitude, "Thank you for your cooperation." This leaves a positive final impression. And critically, always state your intention for documentation. "I will document my findings and report any abnormalities." This reinforces your professionalism and commitment to continuity of care. Using these phrases confidently and appropriately will significantly boost your communication marks. The OSCE often follows a structured 5-minute format, and mastering this formula is key to efficient and successful performance. Let's break it down. Minute 1. Read instructions carefully. This is absolutely critical. Take your time to understand the scenario, the patient's condition, and the specific tasks required. Don't skim. As the sticky note reminds us, never rush the beginning. A clear understanding here prevents errors later. Minute 2. Gather equipment. Once you know what's needed, efficiently collect all necessary items, ensuring they are clean, functional, and easily accessible. Minute 3. Explain and prepare. This is your communication time. Introduce yourself, confirm the patient's identity, explain the procedure, and obtain consent. Simultaneously, you're preparing your sterile field or equipment. Minute 4. Perform skills systematically. Execute the clinical skill following the correct sequence and technique, prioritizing patient safety and maintaining asepsis. Minute 5. Conclude and document. After the skill, reassess the patient, thank them, ensure their comfort, and verbally state your intention to document your findings and any abnormalities. Following this structured approach ensures you hit all the key points within the time limit. Beyond the 5-minute formula, these OSCE room survival tips are your secret weapon for navigating any challenge. First, read instructions twice. This double-check confirms your understanding and catches any missed details. Second, organize equipment efficiently before starting. A well-organized workspace reduces stress and saves precious time. Third, speak aloud professionally when performing actions, even if it feels strange. This demonstrates your thought process to the examiner. Fourth, think systematically by following a logical, step-by-step process for every skill. Fifth, always maintain patient dignity and privacy. This reflects compassionate care. Sixth, always finish with documentation, verbally stating your intent, as discussed. And finally, if you make a mistake, stay calm. Acknowledge it, correct it if possible, and move on. Panicking will only derail your performance further. Your composure under pressure is also being assessed. To ensure you cover all crucial steps in any patient interaction, remember the I prepare mnemonic. It's a systematic framework that guides your actions. I stands for introduce yourself, clearly state your name and role. P is for patient identification, verify the patient's identity using standard protocols. I means request consent, ensure the patient agrees to the procedure. E is to explain the procedure, inform the patient what you're about to do and why. The second P is for prepare equipment, gather and set up all necessary items. I remind you of aseptic technique, maintain cleanliness to prevent infection. The second I is to review patient comfort, continuously check on the patient and address any discomfort. And finally, the second E is to evaluate and document, assess the outcome and record your findings. Make it a habit to use I prepare every time. It's a robust checklist for safe and professional care. While OSCEs cover a broad range of skills, certain high-yield stations frequently appear and require focused preparation. In assessment, be proficient in taking vital signs, performing thorough pain assessment, conducting respiratory assessment, and understanding neurological assessment. These are fundamental to identifying patient status. For procedures, master skills like wound dressing, safe injection administration, catheter care, and fall management. These require precision and adherence to aseptic technique. In maternal and child scenarios, anticipate antenatal assessment, comprehensive newborn examination, and precise growth monitoring. These are sensitive areas requiring specialized knowledge. Lastly, be prepared for emergency situations, including CPR, recognizing and managing shock, and administering oxygen. These scenarios test your ability to act swiftly and decisively under pressure. Prioritize your practice in these areas. Now, let's learn from common pitfalls. Being aware of these common mistakes can help you avoid them. First, forgetting hand hygiene is a critical error. Always perform it both before and after patient contact. Second, failing to identify the patient is a fundamental safety breach. Always use two identifiers. Third, not explaining the procedure neglects patient education and consent. Fourth, breaking sterile field directly compromises patient safety and infection control. Fifth, poor communication leads to misunderstandings and reduces patient trust. Sixth, an incomplete assessment can miss vital clinical information, potentially harming the patient. Seventh, leaving the patient uncomfortable demonstrates a lack of empathy and attention to care. And eighth, forgetting documentation means your actions aren't recorded, impacting continuity of care and accountability. Remember, as the sticky note warns, small mistakes can cost big marks. These often reflect fundamental safety and communication deficits. Preparation extends beyond clinical skills to your exam day checklist. Ensure your uniform is clean and professional. Always bring your identification badge. Have multiple pens ready. A watch with a second hand is essential for vital signs and timing. Bring water to stay hydrated, and tissues for personal use. Hand sanitizer is a good habit. Most importantly, cultivate a positive mindset. As the tagline states, be early. Be prepared. Be professional. These small preparations can significantly reduce stress and allow you to focus purely on your performance. Building confidence is an ongoing process. Embrace the daily OSCE challenge by consistently practicing core skills like blood pressure, pulse, temperature, respiratory rate, hand washing, patient education, and documentation. Even small, focused practice sessions add up, leading to big success on exam day. In your confidence corner, always remember these truths: you have practiced, acknowledge your hard work. You know more than you think, trust your knowledge base. Safety first, prioritize it above all else. One step at a time, break down complex tasks. Breathe. Assess. Perform. A mantra for calm execution. As a final reassurance, internalize this message: you are capable. You are prepared. You will succeed. Believe in yourself and your training. Even with thorough preparation, nerves can strike. This quick calm technique is your immediate stress reducer. First, stop. Take a second to pause. Don't panic or rush. Just halt your actions for a moment. Next, breathe. Inhale slowly and deeply, filling your lungs, then exhale fully. Repeat this a few times to regulate your nervous system. Finally, focus. Direct your attention to the next right step in your procedure. Break it down into manageable chunks. Remember, you've got this. The goal is a calm mind. Confident hands. This technique helps you regain control and perform effectively. You've now navigated the entire OSCE success blueprint. Remember the profound truth: every expert nurse was once a nervous student. Your journey is part of a shared experience. The keys to your success are simple yet powerful. Believe in yourself, acknowledging your capabilities and growth. Work hard, dedicating consistent effort to practice and learning. Stay humble, recognizing that learning is continuous. And always, keep caring, letting empathy and patient well-being guide every action. This blueprint, brought to you by the RHW Visual Nursing Notes series, is your companion. Go forth, practice with purpose, perform with professionalism, and always prioritize patient safety. You are ready to succeed. Click the link https://3star.rhwsystem.com. Create your account and choose your program. Once you log in, navigate to the sidebar and enter the Skills Lab. You'll get a number of OSCE common procedures. Learn.